I have so many water bottles. This is the last LaCroix. I've been drinking them. 9 days till the exam. It is coming up quick. I am here to answer everybody's questions, because I know you guys are nervous, and it's been my goal to try to go live more often, because I feel like, oh, hi, Silke. How are you? I feel like everybody's scared, so I need to go live more often. Also, I feel like, and you guys can tell me if this is something that you guys have craved or not. Like, I feel like, especially in today's day and age with all the AI, that like people are getting more and more worried that things aren't real. So like I'm trying to come on lives more often, so then like I'm like real. So then that helps. Hopefully it worked for me to go live on Instagram. Instagram people, can you see me or hear me? I just want to see if this is working. So I hope it works. I know I went live to Instagram. Okay, everybody can hear me. Am I frozen on Instagram? Or can you guys see me? I know TikTok can see me, so we're good. So if the quality is horrible on Instagram, oh wow. They don't curve the exam. So Sydney asked, do they curve the exam? Okay, they're saying I'm not frozen. So maybe it just looks like it's frozen for me, but it's actually not. Okay, as long as it's working. Everybody can see me. That's all that matters. So yeah, we're here to ask questions, just chat a little bit. Yeah, do they curve the exam? They don't. It doesn't matter how other people do. All that matters is like if they go in and they see, oh, that question looks like it's not really like a good question to continue to give to students. So they might, like, if it's one of the ones that like doesn't count, they're like, okay, that's not going to be one that we're going to have in. But yeah, it doesn't matter how other people do. JB Hall says, I got a 634 on my Pete today. Let's go. Why are you concerned? Like, I'm concerned. I'm not concerned. So maybe, so if I'm not concerned, hopefully that makes you feel better. Oh, guys, my dad's here. Hi, Dad. How are you? Yes, good. It's feeling good, but deaf nervous. Yeah, no, you're good. You are good. We also have people here on YouTube. So hello, YouTube people. If you guys have any questions, feel free to ask. This is a safe space for us to ask questions. I'm set for the July exam, just nervous. Yeah, you'll never feel 100% and you'll never feel good to go. But like, guys, if you're passing your PETs, like you're getting above a 600, like the odds are in your favor that you pass. Like there's a research study. I have to find where it is because I don't know where it went. But I just talked about like if you pass the exam, you're like if you fail the exam, you're like 50 some times more likely to fail the real thing. If you fail the PET, you're 50 some times more likely to fail the NPTE. But then that just means if you pass, like you're really likely to pass the boards. So I very rarely will see people not, I really rarely see people not pass the boards after having passed their PETs. So you pass your PETs, it's a really good sign you'll probably pass the boards. I'm super worried. I did 556 on my PET based off my score. As the section went on, I think working 10 hours and testing might have messed me up. Yeah, I mean, it's not too late to reschedule your test because that's a concerningly low score, especially 1 week out from the test. So I'm just being honest. And yes, working a lot doesn't help. And this test really is something you want to give it the time and attention it deserves. And YouTube doesn't have any questions. Perfect. I'm still, to me, it looks like I'm frozen on Instagram, but I'm not. At least I'm not making a silly face. Or maybe it would have been better to make a silly face. Oh my gosh, Alexa. Is Alexa here? Alexa? Alexa, come back. Did she join? Does it say she's on? I have to hang out on my live bestie. Okay. Do you think people who got in the 590 range on the P will still pass the NPTE? I mean, there's a good shot. There's a good shot of passing. Big thing is just understanding your mistakes. Can you talk about counter nutation and nutation? Bruh, did you see this question on a Pete? Oh. Did you see something about that on a Pete exam, or was it on some random like Final Frontier test? It was on a Pete? Okay. I am like 99% sure. Let me make sure I got this. Okay, yes. So nutation, the sacrum's tilting forward. Well, the whole pelvis kind of tilts forward. So nutation, think of like an anterior pelvic tilt. Counter nutation, think of a posterior pelvic tilt. So I got our nutation, anterior, counter nutation, posterior. And it's about what's happening with the sacrum. So as the sacrum comes up and forward, that's nutation. As it comes down and back, counter nutation. I hate that. Was that on a Final Frontier test? Final Frontier really focuses Alton PT. What's Alton PT? Or is that supposed to say a ton on a lot on PT? Yeah. Yeah, so Final Frontier, they are a great company. They do really great things. I talk to them all the time. They're very great people, and they are here on a mission to help everyone. With that being said, definitely their material is more PT focused versus PTA, which can get really confusing. So that's the only caveat there, but I really like them. So this is not me shit talking. Nobody go and say like PTA elevation talking shit on. No, it just is their specialty is PTs. That's like their specialty. They do help a lot of PTAs, but unfortunately, when they created their stuff, it was mostly for PTs, and that kind of overarched. So yeah, they do have some PTA specific stuff. But yeah. It says, do you have a choppy video? Do you want to restart? No, I'm not restarting. We have things to cover. Oh, we have some questions on YouTube. I've been taking score builders tests and I've been getting out a 70%. Unsure how to boost my odds a little bit more this last week before the exam. Worry about not passing the NPTE. You're fine. You're going to pass. You're worried, go take a Pete and you'll probably pass. I'm sure you're going to be A-okay. I don't mean that in like a apathetic kind of way. You're doing just fine. And you're struggling with Gait stuff. Oh, if you're struggling with Gait stuff, you should watch our last minute review session. That was a lot of fun. We did a lot there. I'm sure a lot of you guys were there who are listening right now, but should we look over Ottawa ankle rules as a PTA? Don't worry about it. I didn't know it existed till I went to PT school. You do better on the Petes than the score builders. Perfect. I think the Petes are a better like assessment of your readiness for the test. So as long as you're doing good on the Petes, it's all good. The score builders are pretty tough. I've been getting in the 60s on the score builders. They're so hard, but then I passed the Pete. Yeah, that's good. Exactly. How much should we know about joint mobilization? So definitely know about like what direction will increase what. Know the convex versus concave. Still very important. I know if some of you are like me who live in Pennsylvania, physical therapist assistants can't do mobilizations, but if I just cross the border over to Maryland, I can. So it's a national test. So mobilizations are definitely important to know. So it says college dumb bitch 45 just got the glitter sticker. That's so funny. Do you know if there's sample tests for the CLT certification? That's for lymphedema, right? I can ask some of my friends. I'm sure there are. I'm sure there are. I'm glad you found the, yeah, Chris, I remember you were there at the review session. I'm glad you found it super helpful. I'm sure there are practice questions. I can't think of a single standardized exam where there isn't practice exam questions to help you study. I'm if I could bet, I would say there probably is something out there. I don't know of it specifically, but I have a good idea that it's out there. How to overcome testing fatigue. What I was talking about with the review session on, so I talked about this at the review session on Sunday. Biggest thing for me for overcoming test fatigue is just reminding myself, like, do I want to be here spending like $800 to do this again and not working the job that I want to do? And that usually lights a fire under my ass to like get me back going. Oh, I'm glad you guys found the review session super helpful. It was fun having everybody there. I enjoyed it. It was a good time. Looking to get certified in lymphedema therapy. That sounds like fun. I mean, not fun for me. Oh, how can we watch the last minute review? So if you go to ptaelevation.com, actually, okay, wherever you are right now, just go to my link in bio and you'll see the review session is right there. So if you're on YouTube, I think if you go to ptaelevation.com/resources, the last minute review session is on that page. If not, Instagram, TikTok, all y'all got my link in bio. So that's there. So you can buy it literally up till the day before the test. I would not recommend doing that. If you want to buy it like today and watch it throughout the week, I think that that's a good review. But don't be watching it like the day before. That wouldn't be good. But yeah. Oop, I missed some stuff. For all of my practice tests, I have about an hour left. Do you feel like I'm going too fast? Do you think I'll have time to take a mental break in between each section? Yeah, I mean, I don't think it's too fast. I think it's fine. But yeah, you should be able to have a mental break between each section. That should be fine. Should we know lymphedema versus lipedema? Yep. So lipedema lipedema is usually bilateral. It'll spare the feet, so the feet aren't affected. Lymphedema, usually unilateral, swells all the way down the leg. I don't remember me. Oh yes, I remember you, Diana. I'm glad to hear you're doing well. That's awesome. Thanks, guys. I really appreciate you all. You guys are doing great. Appreciate it. Thank you. Gifter badge. Are people giving me gifts? I hope you don't have to give me gifts. I don't even know how this works. You work at a skilled nursing facility. That's awesome. See, look, guys. See, Diana was right where you guys were a year ago, and now everything's fine. She didn't die. The boards didn't kill her. I haven't taken a Pete since May. Would you recommend to take another Pete later this week as one final hurrah? Yeah, I would take a Pete. Yeah. Stressing out now, LOL, a little over 1 week away. Your review was great. Yeah, I'm glad. I'm glad you enjoyed the review, Trinity. I thought it was fun. I got a 536 on my first Pete and just got a 568. Should I be concerned? Are you taking the exam in July? I would reschedule because you're making good progress, but I think you need more time. But if you're like, I just want to take it and see how it goes, like at this point, it's like, that's your life. But if you want to like study really, really hard, I'm not saying you can't pass. I'm just saying that's a little risky. I feel like I'd do a disservice if I said, oh yeah, you'll be fine, you got this. Like, you will pass. You might just need some extra time. And there's nothing wrong with that. So just take some time to think about that. But don't let it knock you down. I'm going to fail the board exam. I've taken 3 tests and I got 580s on all of them. What do I do? Tested a week and I lost motivation. I would just go through and study your tests again. I mean, there's a quote that says, whether you think you can or can't, you're right. So really this last week is about mindset. So if you've already written yourself off that you're going to fail, then you might. But you can also work hard and get yourself up over that passing score. 580s is not a death sentence. It's not. But it's about how you talk to yourself at this point. Oh, hold on a second. Thank you. Have a good day. Oh boy, guys, I got my snacky snacks. I got my chicken tendies and fries, guys. I am ready. I can accomplish anything now that I have my chicken tendies and fries. Everyone else feel that way? Okay. I have problems with the parameters of ultrasound, e-stim, EMGs, biofeedback. I need some ways to remember. Ooh, I was supposed to only have 3 tendies, and they gave me 4. Oh my. We talked about ultrasound, the review. I have a video on e-stim. Big thing about biofeedback is it's not giving electricity, it's sensing it. That's the biggest thing to think about. And with ultrasound, think about what are the parameters you would do to heat up the tissues, and then what are the ones you would do to not heat them up. And so to not heat them up, that's good for acute. If you want to heat them up, that's good for chronic. That's a simple way to think about it. So I hope that that kind of helps you. Yeah, so you rush through, so I got a 574 on my PEAT, and I reviewed my exam, and I rushed through 10 questions in a row and got them all wrong. So big thing is noticing, okay, when you're taking your actual tests, when you start doing that, notice that you're doing that, and then do the strategy of do the 10 questions. And then when you notice you're starting to do that, go backwards 10 questions, go 10 questions back, and then retake those questions to really give a good look at them. What's the minimum you recommend on the PEAT? For the PEAT exam, I would say like even if you got a 570 or higher, like you still could pass. Like obviously a 6 is like the most comfortable minimum that I would say. But like a 630 is like you're in a good spot. What do you think about score builders, exams, base camp? I mean the exams are helpful. They all teach you the right stuff. I'm not a big fan of base camp. I just feel like it's not teaching you in a productively learning way. But some people really like it. So it's personal preference. You can always try it out and see if you like it. Taylor here says, I got a 666 on my PEAT, and then I took another PEAT and got a 702. How should I be feeling before next Tuesday when I take the boards? You should be feeling like $1,000,000, Taylor. You are ready to go. All right, I have 550 on my exam in 1 week. I'm going to take another PEAT. Yeah, take another PEAT, see how it goes. If you're still not scoring well, it's kind of getting really too late to reschedule. So do the best that you can with your studying. Sorry, I have a lot of questions here. I don't know what this means because you didn't give me a score out of 800. You took your PEAT, you didn't give your PEAT. Just letting you know. There's a common error people make with English. Just wanted to let you know. Not being rude or anything. So let me know what that score was out of 800, and I'll be able to give you a better idea. But it sounds like you're taking the PT test. But even like in this above 60% is usually on the right track. But let me know that score out of 800 so I can give you a better explanation there. Yeah, so don't change your answers. Don't change your answers unless you have indisputable evidence to change it. So unless you can explain to me why you're changing your answer, don't change it. That's a good way to think about it. Osteomalacia versus osteogenesis imperfecta. So osteogenesis imperfecta is a disorder that happens in children. Well, I guess it can happen. It's a genetic condition that appears in infancy and in utero. Osteomalacia is softening of the bones. So that's like rickets. So one is hold on. I don't want to be rude. One is acquired, which is osteomalacia. The other one is inherited, which is osteogenesis. What's the minimum score you recommend for the PEAT? I think I just answered that. I mean, ideally over 600 is good. But I did answer that a couple minutes ago. I think you wrote that previously and I answered it. What did you eat before you took your exam? So guys, I have a whole video on YouTube where I talk about everything I did before I took my test. It's literally a vlog of when I took my PT exam. So do that. Yeah, definitely higher in carbs is helpful. Hi, PJ. How are you? Oh, good job, Megan. Megan just took my practice test and she got a 63%. She found the podcast helpful. Do you need to know all pediatric guidelines? Not the guidelines, but know the timeline of like up to about a year. And then when the reflexes integrate, that's the most important thing. If you're going to take my practice exam, try to take it sooner rather than later. Getting a 640 on the PEATs, though, you're in a good spot. I'm so ready to be done with this test. Anything above a 630 usually indicates you're good to go. Cassidy, I still think there's a good chance that you can pass in July. It's just going to be about studying and getting your mindset right. Guys, a good headspace and a good mindset can increase your score by 50 points. So talk kindly to yourselves and really focus on this last week of hyping yourself up. Don't memorize names of medications, memorize what they do. It does give you one score for the PEAT. If you look in the column that says scaled score, it will give you a single score. Oh, you mean between your two P's. I'm sorry, I misread your question. What I would say, guys, put more weight on how you did on your retired exam versus how you did on the practice exam for the PEATs. What'd you bring on test day for 2 forms of ID? I brought my driver's license and like a credit card. I also brought my passport because I panicked. Glad to hear you're doing well, PJ. All right, TikTok. If I just invited somebody, ignore the invite. I did not mean to do that. What's the most important thing I could do in the next week? Focus on your mindset. Stay positive. What's a good way to answer a question where I have no clue which option to pick? Just see which one calls to you. Channel me. Think, what would Bree do? No worries, as long as you got the question answered. How important are the arterial blood gases? They'll definitely show up. I have a video about this on YouTube, though, that should help you guys. With the wound stuff, a lot of the wounds things is covered in the Score Builders book. But like, if it's superficial, you'd use transparent film. If it's like really like heavy exudate, you'd use like an alginate. If it's like you're packing a wound, you use gauze. Like I would say for each wound dressing type, pick a condition that you would want to use that with, and that'll help you narrow down. So that's my tips on wound dressings for you guys. Yes, it should be 70 and older. I redid the burns video, so I'm going to be putting that in. Oh, Evan, are you in my course? I didn't know that. Are you talking about like the review session? I don't want to burn you. Oh, yay. Hi, Patrice. It's good to see you. Patrice passed her boards in April, and she was in my program. So thank you for the vote of confidence. Y'all, Medicare gonna do what Medicare wants to do. Medicare gonna do what Medicare wants to do. They're cutting it for PTs too. They're cutting it for PAs. They're cutting it for doctors. Everybody getting cut. And you know what administration's not going to funnel more money into Medicare to reimburse us? This one. Not to be political, just stating facts. My opinion is I'm glad I have my own business. That's my opinion. Cash-based PT is also a thing. Main differences between obstructive and restrictive pulmonary diseases. Yeah, we covered this at the review session. Not sure if you were there, but that would definitely help you with that. But obstructive, the lungs get bigger but less efficient. Restrictive, everything goes down. It's smaller. That's the SparkNotes version of it. Both obstructives struggle getting air out. Too much like residual volume. Lungs increases total lung volume. That's the biggest thing that you want to remember for those. All right, I'm from India and I'm going to become an IAS. I'm not sure what that means, but you know, I'm proud of you and I want you to accomplish your dreams. How do you remember the modified Ashworth scale? As the number gets higher, there's more spasticity. I don't remember the exact numbers at each level, but that's how I remember it. The higher the number, the more spastic the muscle is. Should we know symptoms of each level of spinal cord injuries? I would say know more of what they can do, know abilities of each level of spinal cord injury. So it'll help you determine what's appropriate for an intervention. Yep, they have a locker you can put all your stuff in when you're at Prometric. Ooh, I accidentally got a notification my battery was dying. Let me know what other questions you guys have. Not trying to just be creepy and eat. Excuse me. Sorry. But hopefully you guys are doing well. Oh, hi, Kaylee. Everybody follow the study, Miss Smitty's study guide. She's great and super helpful. We love you, Haley. Yeah, exactly, PJ. Nice seeing you too. But yeah, all you guys definitely got this. My practice exam is its own thing. I don't try to make it just like the P. I kind of ask similar questions in the way the P asks them. This year's Pete was made after I made my test, so I wouldn't have been able to see that. How do you feel about your program in Final Frontier? I think we just kind of talked about this a little bit. Like mine's definitely 100% geared towards PTAs. Final Frontier kind of leans towards PTs. Very PT content heavy. But it's all correct. And they really do care a lot about their students and they want to see everyone pass. So I think when people are choosing a course to go with, they need to go off of vibes. Like which course would you rather spend more, like who would you rather spend more time with? Who feels like it's helping you click better? Like I have people come up to me, they're just like, your stuff was helpful, but like I really just felt like the Final Frontier videos like hit it home for me and made everything make sense. Awesome. All we all care about at the end of the day, well, I can't speak for every prep course. Y'all know who I'm talking about. But definitely between me and Final Frontier, we all care about you guys passing at the end of the day. That's all we care about. We want to see everyone be successful and pass the boards. That's the number one thing. That's all we care about. So whatever works for you. I just want you guys to find stuff that works for you. Oh, Verbane. Go on YouTube and watch my video on congestive heart failure. That's going to cover pretty much any question you might have about that. I think that's going to be really helpful for you and worth your time. Yeah, on the bright side, the boards has a standardized about like where people are with studying. I'm trying not to be too weird with the eating. Like I'm like, this is not a mukbangs video. Like I'm just eating my fries. Like hopefully it doesn't seem too weird. Hopefully it just seems like we're just hanging out. We're on FaceTime and I'm like just eating some fries. Cardiac rehab phases, METs, and when to discontinue exercise. Obviously, if there's any like chest pain, you discontinue exercise, or if any of the vitals go out of whack. But cardiac rehab phase is like first, like we talked about this the review session. Stage 1, inpatient. Stage 2, outpatient. Stage 3 is like group fitness classes, and stage 4 is like your own independent thing. So really, you're discontinuing when the METs get out of whack. But then there's different phases of heart failure, and you can do certain things at different phases. Megan, if you didn't already, I would definitely go watch the review session because we talked about that there. But the big thing about lung volumes and capacity is understanding that they're going to change. If it's obstructive, everything kind of gets like residual volume and total lung capacity gets bigger. And then all the important ones of vital capacity, those all get smaller. And then with restrictive, they all get smaller. I'm glad you've been enjoying the podcast, though. That's awesome. PTA elevation is worth the investment. Oh, thank you, Selke. What's the difference between the NPTEA? I'm assuming that means the assistant one, the NPTE. So the physical therapist exam is for physical therapists, and then the physical therapist assistant exam is for physical therapist assistants. With the PT exam, you're going to have more of a focus. It's going to be longer. It's going to be a whole section longer, so a whole 45 extra questions. It's an extra hour of answering those questions. And then it's going to be more evaluation, examination focused. And then the PTA one's more about like appropriate chart reviews and picking appropriate interventions based off of what's going on. Yeah, Andrew, it sounds like the Pete went well. I know you messaged me on school. I just hadn't opened it yet. It sounds like it went really well, and that's totally normal. The Pete is so straightforward. I feel like it's easier to get through. Yeah, I would say like 80% of what, like 80% of what's on the PT exam is fair game for PTAs. MSK tips to focus on, like gait is important, and the pathologies of like the shoulder and knee. What condition would you see clubfoot? You can see it sometimes with like cerebral palsy, but a lot of times it can just present idiopathically by itself, like as like just a regular congenital condition. Let's go. Yes. Get over that 650. If the company doesn't offer CEUs, what do you recommend? A lot of people really do like MedBridge. You can always post on like one of those PT forums. Be like, hey, what's a good one? And then they're like, PT is a horrible profession. Well, it's like, shut up. It's like, I asked about the CEUs. So, I mean, a lot of people I know really like MedBridge. So I don't have anterior compartment syndrome because that's in my leg. I have forward head and rounded shoulders. I've not been doing my pec stretches. I have been at the beach, which is relaxing my like upper part. But I'm very hunched right now. I have thoracic outlet syndrome. I'm not taking good care of myself. This is what we realized when I did this retreat in Florida. The higher the METs, the harder the activity is. So like running would have a higher METs than like watering plants. So I'm thinking about for what stage the patient's at, what's an appropriate activity for them, and then you can look at the METs that are associated with it. So the PETs aren't tricking you, they're testing you. They're testing you because you need to know this. So yes, spinal stenosis is flexion, which is a posterior pelvic tilt. And then with ankylosing spondylitis, they're stuck in this flexion and posterior pelvic tilt. You want to try to get them to extend with the ankylosing spondylitis. You want to get them to extend. They don't want to extend, but they need to extend. I found your quiz is very helpful as well as PTA 365. Thanks. Girl, start my review session ASAP. It's like 12 hours of content. Start it ASAP. Hope I missed. Yeah, there's a lot of things that PTAs have to know. What videos am I doing next? Let me look. I reposted the burn video. A video on Down syndrome coming out. A video on torticollis coming out. I'm remaking a video on DVTs as well. So I have that. So yeah. How can we access a review session? Go to my link in bio, and there'll be a thing that says buy the review session. It was a lot of fun. I had a good time. What's the range for passing score on the PTA boards? A 600 is passing. I take the boards in 9 days. Oh my gosh. Yes, y'all got this. How much for the review session? I think it's 97. Fix that wig ASAP. Are you talking to me? I'm not wearing a wig. The review session is $97. But I think it's worth it. Everyone who came said it was worth it. Oh, it was with thoracic atlas. Stages of development. Do you mean like pediatric development? Yeah, a lot of people are saying it was worth it. Cool. Thanks, guys. I'm sure everybody saw that at first. It was like $97. That's a lot. Okay, I think I'm done eating my fries now. No more fries. So everything about the review session, you can find a bunch of FAQs on the link in bio when you look at the review session. But we talk about a lot of practice questions. We do some scenario questions. We talk about tips for exam day, test taking strategies, test taking anxiety. We cover a lot of topics people are confused about. It's fun. It's not like the score builders one. No. This is like 12 hours of chaos studying with Bree. But it's like fun. But it's a lot. Score builders is very professional. I'm not professional. Or I don't know. I'm just chaotic. I rebuke Jesus. Okay. That's a personal opinion. Is it live? So it was live. So you'll get the recording of it. The full recording. You won't miss a single second of what happened. Chaos is fun. Somebody is writing some weird anti-Jesus stuff in my chat, which is like the first time somebody has done that. If it bothers someone on TikTok, just let me know. I'm just letting him do it for engagement. We just won't read those messages. For torticollis, it's best to be located on the side the patient's turned to. So, like their head's turn or their like the rotation? Is that what you're talking about? I just want to make sure I understand what you're saying. I think this person's writing too many weird things. I muted them. Hee hee. Now you can't speak. You want to be on the side away from where they're turned to, so then they'll be more inclined to turn to you. So it's not like a stroke patient. The baby doesn't know what's going on. So you just want to be in their field of view. I failed all my score builders exams and passed the NPT on my first attempt. So you guys got this. Exactly. I think I said what comes in with the review session. But if you want to look at, you can just look on the website, but we cover a lot of topics. We have like 12 hours of content review. How often do you have the review sessions? Before each exam, I do a 2-part review session. Yep. I've been going through the book and reviewing for the last week, but yeah, just as long as your Haley, as long as your practice exams are doing good. Stages of motor control. I'm not sure what you're exactly referring to. I kept scoring 50% on all my practice exams. Oh no, that's not good. I know it's not what you want to hear. I could invite people to join my fan club on TikTok. Do people want to be in the Bree fan club? How do you get your brain to just spit out everything in the score builders book and it's accurate and nothing is missing? It's a lot of repetition. I have looked at that book inside and out. I have been teaching this. I've been studying this since 2019. Constantly. It's all in there. When you've been asked the same questions over and over, it's in there. But I still look stuff up. I looked, like, somebody asked me a counter nutation. I'm like, oh my God, it might have been you, but I can't remember who asked about it. I was like, let me go look that up again, because yeah, it's off the dome sometimes. Score builders, final frontier, turn into PT elevation. Cool. Yeah, this will be the last question I answer because it's getting late at the hotel and I don't want to be the person who's making a lot of noise in one of the rooms. Can you explain what passive insufficiency is? I know it's related when a muscle crosses 2 joints, but I don't get the way they asked the question. Yes, with passive insufficiency, it's you can't stretch the muscle over the 2 joints. So like hamstring stretch, that's bringing it to flexion and knee extension, hip flexion, knee extension. So it won't stretch all the way. So when you look at the question, if it's saying, oh, it can't stretch all the way, or like it's being limited by a muscle that can't stretch, that's passive insufficiency. Or if like passive range of motion is harder, that's all passive insufficiency. If it can't like contract all the way through that full range, and it's more of an activating the muscle kind of problem, that's the active insufficiency. Okie dokie, friends. I think I'm going to call it a night. I hope that you all enjoyed this. I will see you guys later. I just don't want to be up yapping too late. All right, everybody, take care. Make sure you guys have taken a peek before you take your test. And I will see you guys soon. Bye, everyone.